Spending over 10 million to save a child, or just let him or her pass away? What is your choice? It might be really hard, however. That is a choice that parents of children born with spinal muscular atrophy have to face back in 2019. Spinal muscular atrophy refers to a rare inherited neuromuscular disease characterized by progressive muscle degeneration, which can affect patients' speaking, walking, swallowing, and breathing, causing disabilities and even threatening their lives. It is classified into 4 phenotypes on the basis of age of onset and motor function achieved. SMA type 1 is the most severe and common type, which accounts for 50% of the patients diagnosed with SMA. Even though it is defined as rare diseases, there is one carrier among 50 people, and thus the baby of the 2 carriers has 25% of possibilities to suffer from this disease. It was not until 2019 that the medicine for curing SMA, Spinraza, finally came to China, as the approval of Spinraza is a historic achievement for the entire SMA community. It is a proof that therapy is possible.
经过3-4次注射后，本来只能瘫坐的四肢逐渐有了力气，已经能渐渐支撑身体，甚至可以简单爬行。
Sun Mingxi was one of the patients who received injections most early. His mother, Yu Lanhua, is a migrant worker, and his father, Sun Fuguo, is a truck driver. Even though they did not have much money, they still decided to try the medicine as soon as possible. After Sun Mingxi had been diagnosed with SMA, Sun Lanhua's hair gradually went gray. Before giving birth to Sun Mingxi, she had 3 times of ectopic pregnancy and has tried 3 times of in vitro fertilization. Nevertheless, Spinraza costs 70,000 per 5 millimeters. The patients have to inject 6 needles of Spinraza in 1 year, and then inject 1 needle every 4 months continuously, spending an average of over 1 million RMB per year. Donald Krisk, who has been working in the pharma industry for over 40 years, revealed the reason of high medical expenses in gene therapy. The most difficult and important decision in drug hunting is the decision to fish or cut bait, whether to continue investing resources in the pursuit of potential drug or cut your losses and move on. These decisions are always based on inadequate information, so scientists often end up chasing after bad drugs instead of good commercial ones. The frequency of the wrong decision to continue fishing helps explain why 50 to 75% of all clinical trials fail. Fortunately, since the drug combating SMA became included in China's national drug reimbursement list at the end of 2021, more than 1,000 SMA patients have begun treatment with it.
含12方山人。来，看着这什么？不要动啊！听阿姨的话，妈妈在门口等猪猪，好不好？加油！
我一直想着有这么一天，孩子就是能有办法治疗。打完之后拿个，这以前真是有这个药的时候，70万想都不敢想。以前没有希望，现在看到希望了，就是很激动。觉得现在孩子看到希望了，我们家里也看到希望。
Regardless of the reimbursement list, which is an important step towards increasing access to expensive medications, in the future, multi-party joint payments involving individuals, governments, as well as charitable groups like the Mayor Advocacy and Support Center for SMA might be helpful for the patients with rare diseases. Furthermore, If the family income is below a certain level, then the family could be free of charge. If the family income is higher than a certain level, policies could also set the quota to constrain the highest level of payment from individuals. At the same time, the collaboration in research development of medical treatment for SMA is also important. Just like how the representatives of the reimbursement list said when bargaining with the pharmaceutical companies,
用到了患者身上，你的价值就不会被低估。你如果没有用到患者身上，你再好的药、再贵的药都没有用，那是就放在库房里或者在生产线上。要用到了病人身上，在病人身上起到了疗效，才是你们的价值所在。
When there is hope we can continue, no group, however small, should be left behind.